Protecting your brain could begin with your ears. We discuss the research studying a link between hearing loss and dementia on today's All Things Brain Health. Good morning, I'm Alexis Del Cid. Welcome to All Things Brain Health. Have you noticed you walk into a family member's living room or they walk into yours and they tell you your television is much too loud? Hearing loss is fairly common, particularly as you age, but it could be linked to something much more serious. Today, our health system experts explore the link between hearing loss and dementia. Please welcome Dr. Candace Coffey, a geriatrician. Thank you for being here. We also have Dr. Jeffrey Burns, a neurologist and co-director of the Alzheimer's Disease Research Center, who's joining us virtually, and Dr. Lauren Mann. Dr. Lauren Mann is a neuroaudiologist. So thank you all for making time with us to join the discussion. Dr. Burns, before we get to this study, a lot of people ask, how do you define dementia and what's the difference between dementia and Alzheimer's disease?
Okay, yeah, great question. That's the number one question we get is what's the difference between dementia and Alzheimer's? And dementia is a broad term that simply means memory and thinking changes that are new and that are progressing to a stage where they're interfering with daily function. So people aren't doing the things they used to do as well. So a lot of things can cause dementia. So broad term, lots of things can cause that. And Alzheimer's is one of the causes. So the key, so Alzheimer's is a subset of this sort of umbrella term of dementia, but it's the number one cause. 60 to 70% of dementia is Alzheimer's, but other things cause it. Stroke, head injury, brain tumor, things like that can cause dementia, which is why we do the evaluations we do to determine what could be causing it.
Got it. So everyone with Alzheimer's has dementia, but not everyone with dementia has Alzheimer's?
Right. Yeah.
That's accurate. Dr. Coffey, at what age do you typically start seeing dementia patients, or what age do you see them start showing those signs?
Great question, Alexis. Normally, we start to see signs or symptoms or hear from patients around age 65. And that's not hard and fast for everyone, so I don't want you to think once you hit 65, you might start developing symptoms. But around that time is usually when we start to hear from folks that they notice subtle changes.
And Dr. Mann, at what age do you start to notice hearing loss symptoms?
That's a great question because it's a lot earlier than you think. Most people assume that hearing loss starts in the 60s or 70s, but we often see signs starting in the 40s and 50s. And it isn't that things are too quiet or that you notice I have a hearing loss. It's that things start to become too fast or you have trouble hearing in noise. And it's really the brain that gives us our first clue that something's going on.
So the research is pretty fascinating, and I want to give our viewers a peek at that because the findings were published in the Journal of American Medical Association. In this study, they sampled nearly 2,500 adults that were over the age of 80. Here's what they found. People with moderate to severe hearing loss were 61% more likely to have dementia than those with normal hearing. And then wearing hearing aids cut the risk of dementia by nearly a third. That is huge. So Dr. Burns, based on this research, do you think hearing loss is a cause of dementia or is it a symptom, an early symptom of dementia?
Well, that's the big question. And I mean, it goes both ways. We know that if you have hearing loss, you're not hearing things as well. And if you can't hear things as well, you can't learn as well. So if it doesn't get in, you're not going to learn it, you're not going to remember it. So hearing loss has an impact on memory and thinking. But studies like this show that memory and thinking also may overlap with hearing loss. Changes in memory and thinking may overlap with hearing loss, and doing something about it, like using hearing aids, may impact the memory and thinking and maybe the process of decline.
Is there any science behind struggling to hear, possibly the act of your brain struggling to process sound negatively affecting other parts of your brain?
I mean, it certainly could. So yes, again, if it's not getting in, we're not getting that stimulation in the brain. We're not getting that sort of that cognitive and information stimulating the brain. Then we may see changes in the brain long term, where we see loss of those cognitive functions.
So, Dr. Mann, are there different types of hearing loss? And if there are, does this study take that into account?
Yeah, good question. This study really focused on age-related, what we'd call sensory neural hearing loss. And this is a problem in the inner ear. It isn't a temporary condition like an ear infection. And this type of hearing loss is really what we consider treatable with hearing aids.
What about, did the study take into account, well, they mainly studied people 80 and over, so it didn't. But I always wonder about kids blaring their earbuds too loud. And is that going to affect their memories later on? Are you seeing younger patients come in with hearing loss?
Like I said before, in the 40s and 50s, we start to see the signs. It begins. And I think noise is certainly going to impact the next generation of hearing aid users if we don't get it under control.
Right, we don't figure out a way to turn it down. So Dr. Coffey, are there differences in how you do cognitive screenings with your patients that have hearing loss?
Yes, and one of the very first things that we do is ensure that our patients can hear us. And if they cannot, we stop the cognitive screening and try to optimize hearing in that environment, whether it's making sure that the room is as quiet as possible, that we're looking at one another like you and I are now, if we need to change the screening tool that we're using, because most of the screening tests are actually a combination of verbal questioning as well as some written instructions that the patient has to follow. So we do prefer that individuals actually have any sort of hearing devices that they need with them on the day of their screening, so that we can get the best chance of success for their testing from them.
That's what I was going to ask. Do you prefer people to have their hearing aids with them for these screenings?
Yes, we do.
Now, the Kaiser Family Foundation reports that only 29% of aging Americans with hearing loss use hearing aids. Only 29%. Why is that?
I think there are a number of reasons. One of them certainly is cost. There's a variety of cost amongst hearing devices, and there are a variety of hearing devices. Some insurances do pay for screenings and for hearing aids, but others do not. Additionally, when we talk about hearing rehabilitation, which Dr. Mann could also talk to us about, sometimes there's a lack of access to that, and it can be challenging to do rehabilitation in your area. And so I think some of those are reasons why older adults may not always have hearing devices with them.
To go back a little bit, you have patients who tell you their insurance didn't cover their hearing screening?
Doesn't have an option for hearing.
Oh, wow. So Dr. Mann, if we treat hearing loss in older adults, then that does reduce cognitive decline. Is that what you see to be true?
Yeah, that's what the evidence is telling us, that the brain is expecting to hear all the time. I always tell patients that your eyes close and your ears don't. So if we take away sound, we're really cutting off, as Dr. Burns mentioned, learning and memory and access to the world around us. So it has more implications than just not being able to hear a conversation. It's actually hurting the brain. So putting that back is one of the best things you can do to help slow that process.
Do you see the same symptoms with people who have tinnitus or ringing in the ears?
That's an interesting question. Tinnitus is often a symptom of hearing loss, but it can be from other things like head injury, which is my research area. And I think that sometimes tinnitus is a great clue that something's going on and you need to get your ears checked. And often patients will notice that before they notice any trouble hearing.
Dr. Burns, I've got a question for you. Do you see patients who then get hearing aids and they're not as confused?
Well, yeah, if they, one of the other barriers is it can be hard for patients with dementia to remember to put their hearing aids in or keep track of them. And but if they're doing it, if they're effectively doing that, I've had families say, oh, they're doing so much better now that they've got their hearing aids in. They're, hearing better and they're, remembering better, et cetera. So yeah, I've seen it impact in a sort of visible way from my perspective, some patients, but I also see a lot where it's hard for the patient to do it, and the family feels like they're banging their head against the wall trying to get them to do it over and over and over again, and they're unable to. And yeah, so sometimes that's just a fact.
I could see that 100% happening because my dad had Alzheimer's and we couldn't even get him to remember to put his glasses on. And then one day we visited him in memory care and he had someone else's glasses on and he didn't even realize it. And I was thinking, gosh, he must be feeling so much more out of it today because it's the wrong kind of blurry. He's wearing someone else's prescription and that poor person is probably wearing his. When you have hearing aids, Dr. Mann, do you recommend people wear them 24/7 except in the shower? Or do you recommend they wear them only when they wake up in the morning and go out?
This is a really important question because patients often want to put them in when they're going out to a restaurant or family are coming over or they have a doctor's appointment. But again, the ears don't close. Your brain is always expecting sound. It isn't like vision. So our brain really needs to hear all day long. Unless you're sleeping or bathing or swimming, we want hearing aids in. And this helps reduce the cognitive load. That's the real problem with hearing loss. The fact that your brain is working twice as hard to hear everyday sounds around you. So for patients to do the best when it is noisy, they need to have them in when it's quiet too.
To adjust the ear to be able to...
Exactly. If your brain doesn't have a reference for what's quiet or what everyday sounds are like when you go somewhere that's noisy, it can be really overwhelming.
So not just wearing them on a need to wear, you need to wear them all the time.
You need to wear them all day to do well in the places that you need them. And that's a really hard point for audiologists to get across to patients.
Do you see less confusion in your patients when they start wearing hearing aids?
Less confusion, better understanding, better engagement in their conversations, making more decisions because they're part of the conversation, absolutely.
I can completely see that because there was a time, and Dr. Mann, you know this because I asked for help. I had this really weird whooshing in my ear, but it went on for a month or two. And I was so spacey during that month because it was like I had this whole sound happening here and people would be trying to talk to me and I felt confused and I felt like I wasn't plugged in to the world. So for someone to be able, if you can convince your loved one and it's fixable to get a hearing aid, that would surely help. We love when we get questions and comments from our viewers. So if you have anything that you'd like us to read out loud on the program, right now you can send it to us on YouTube or Facebook, and you can find all the links on how you can connect with us in real time right now on your screen. So that's the science that we've dipped our toe into right now. We asked several adults around Kansas City if they knew about the potential connections.
Are you okay with the hearing? Can you hear okay? And then I'm certainly kind of get the feeling that he wants me to get the hearing test done. But I kept saying no because I'm confident that I'm not near the dementia yet. But like I said before, if my kids ever say it or my friends ever say it, that I am not hearing right or I'm losing it, then I certainly will consider hearing aid.
I am the daughter of a social worker, so I understand the importance of a healthy brain and a healthy mind, and why we need to take care of the brain the same way we do the rest of the body. And I do see how these other things, physical activity, hearing, sight, all those things play into how well your brain is working for you.
Right. Yeah.
It all matters. I think it all plays a role.
As I say, I've heard about it, and it makes sense to me. If you're not hearing everything, then you don't have the full breadth of your perceptions to draw from when you're forming thoughts, and over time, I could see how that could have the potential of creating a problem.
Those are very thoughtful responses. Dr. Coffey, was there anything in there that surprised you?
No, I think that most people have an awareness of some hearing changes, and I think kind of like cognitive impairment, they want to do what they can to improve their hearing. But for those individuals who hearing loss may have come about slowly through life, they may have already adapted and made changes along the way and feel like things are just fine. Whereas others say, you know, I want to be more proactive and prevent hearing loss so that I don't have related cognitive changes in the long run. So I'm not too surprised by what was said.
Dr. Mann, what about you?
I think you hit it right on the head that patients are aware that things are happening, but when it's slow, and you're adapting to it, you don't realize the risk or the problem that you could prevent by treating it early. And to Dr. Burns' point earlier, if patients develop significant dementia, it's harder to get them in a routine.
Yes.
So I always encourage patients that if you're experiencing problems now, treat it now. It'll be so much easier to learn. You'll get that muscle memory. It will become your habit. Then if and when things get difficult, your family will be able to help you keep hearing aids in and keep you connected.
Do you feel like the resistance to wear hearing aids is getting a little bit less with people talking about it more, or do you still feel that resistance from your patients where, I don't want that thing on my ear, I don't want people to see it?
I think the perception that hearing aids are an older adult problem or that they are something to be ashamed of has really changed in the last decade. And thanks to technology, we're all walking around with something in our ear. We're all looking at a phone.
True.
And people are maybe less embarrassed to have to use hearing devices. Also, with over-the-counter hearing aids, the cost has significantly changed for a lot of people. So I see resistance at an all-time low.
Which is so good.
Yes, which is what we want.
I have a couple friends who wear them. My friend Jen calls me from her hearing aids, which I didn't know was a thing.
Yeah.
You can call people from your from your hearing aid if it's hooked up to your Bluetooth.
There are hearing aids now that can
It's so
translate
wild.
for you. I could be speaking to you in another language.
In Mandarin. And
and it would translate it for you.
that's wild.
Yeah.
Dr. Burns, we spoke to one of your patients about one of his first symptoms of cognitive decline, which was forgetting names.
The thing I have the most challenge with is I know the name of every human being I ever met. A taxi driver that picked me up once in London to take me to our facility, I could tell you his name. And right now I couldn't tell you your name except that I can see your badge. So that's probably my biggest frustration, is I've lost part of who I am, is recognizing and knowing people.
It's almost like he's lost a superpower. I mean, to be able to remember the name of a taxi driver from 20 years ago. What part of the brain, Dr. Burns, is affected? What part of his brain has been affected to cause this change?
Yeah, I mean, in sort of the most common type of Alzheimer's, we see memory loss and short-term memory loss. And that's because the part of the brain called the hippocampus tends to get hit earliest. And when we see the hippocampus, get sort of hit by this process that we call Alzheimer's disease, then we see that short-term memory change that we hear about so commonly. People have, a good memory from 10, 20 years ago, but they can't remember what happened yesterday. And that's because 20 years ago, they had a healthy hippocampus storing those memories away, sticking them in the memory bank so that they could pull them down later. But today, they're having trouble doing that. They're less efficient at doing that. And so those new memories, so for instance, storing a name in the memory banks, that's not being put in as effectively as it was, say, 20 years ago. And so, but that's primarily due to that sort of hippocampal system that puts those memories in the memory banks.
For people who don't have a medical background, where in your head is the hippocampus? Where in your brain?
Oh, yeah. Good. So there's two, one on each side, and it's sort of running right in here. If you go like kind of behind the eyes,
Okay.
A structure kind of looks like a finger that's laying this way, running right through here.
And that's the part of the brain. Is it affected on both sides?
Tends to be affected on, both sides. We can see shrinkage of the hippocampus when we do our MRI scans. Often, not always,
Right.
but we always look for, is there visible change in the hippocampus, and when we see it, it's usually on both sides. There may be a little bit of asymmetry, but both sides are affected.
Dr. Coffey, as a geriatrician, what are the first signs of dementia that you notice?
They're often subtle and usually patient self-reported or through a caregiver or a family member. But just like the gentleman, Dr. Burns' patient said, usually it's names that people will notice, that they recognize a person's face, but they can't recall their name. Or it may be those details that are related to the short-term memory, like missing appointments or things related to dates like paying bills, things like that are subtle in the beginning but may be happening more often.
It's so scary when you get older if someone in your family has a history of has Alzheimer's, because I would imagine you don't always know the difference between normal aging. I mean, cognitive decline does happen as we age. So how does someone watching know the difference between normal forgetfulness and then something more serious?
Great question, and I think if you're ever wondering that, please do bring it up with your physician so we can help you try to sort that out, because some of it will mimic what appears to be a cognitive change, but actually may be related to something else, like normal aging, or that you may have had a life change or a lot of things on your brain right now which are actually making it a little more difficult for you to keep things straight. And so we'd be glad to help you sort through those things. But it's a great question, and we often get asked that as well.
And you hear women who might be pregnant or women going through menopause, on the other end of that getting brain fog.
Yes,
and
or
then
medications.
Right, so there could be a number of
sleep,
reasons.
Absolutely.
One of the theories associated with this study is that when you have hearing loss, you might not be as socially engaged, and when you're not as engaged, you become withdrawn, which is something else, Dr. Burns, that your patient experienced.
He used to be the social butterfly. He worked the room, you know, and now he doesn't do that. He really has to pay attention. So if we're with a bunch of people and he's kind of sitting by himself, I'm like, come on, you're isolating yourself. Go stand by, you know, this person, and, you know, and then pretty soon he's in on the conversation. But yeah, that's been difficult.
It's so nice that your patient has his wife there to make sure he stays engaged. But Dr. Coffey, what do you do if the people live alone and there's no one there to be that helper?
Yeah, so I'm glad that you asked this as well, because there are some older adults who are isolated, or individuals who aren't older adults who are isolated and don't have that social interaction. And so I would encourage you, if you're one of those folks or if you know somebody, to engage in other ways that you can, whether it's watching some television programming in the morning, whether it's connecting using your internet resources, if it's communicating with neighbors, friends from your community. Doing that is really actually worth it. Rather than staying alone and isolated, to help make those brain connections, as Dr. Mann and Dr. Burns were sharing earlier, getting that input in any way that you can, and also sharing with others, because there are others out there who could use your input as well.
And it gets harder to network as you get older, so would your advice be to start now?
Absolutely, and forming those bonds and connections so that you can have them as long as possible.
When do people know it's time to come in and ask for a hearing aid?
I think it's difficult to say for everyone, but I think that usually it's not the person themselves that notices it's time, it's the people around them. And if you have a loved one that you notice is withdrawing, is not engaging in conversation the same way, or maybe starting to get fatigued, going out to dinner is too complicated now, or they don't want to go to the family gathering, that's when it's really time to help them come and get a test. And it doesn't mean you need a hearing aid right away. There are a lot of things we can do to help, but it means that your life is changing, you're being socially withdrawn. That's the sign, and that's when it's time to at least come talk to somebody.
We want to get to some of the questions from our viewers and our community, because those are already coming in. And we have a question from Sally that I'm going to give to Dr. Burns. Sally wants to know, so it's the brain shrinking or firing differently? Is the biggest thing shrinking? She wants to know.
Okay, so if we're talking about Alzheimer's disease, we do see accelerated shrinkage of the brain. I say accelerated because everyone's brain starts to shrink a little bit from its peak in, say, around the age 35 or so. And we see some shrinkage the rest of our lives. So kind of like our muscles we peak at some point. But so there's a little bit of shrinkage every year for everyone over the age of, say, 30, 35. But in Alzheimer's, we see a lot more shrinkage, and we can see it in areas like the hippocampus that we were discussing earlier. Now, is the brain firing differently? Yes, we think so. It's a lot harder for us to measure that and to see that. But yes, it's firing differently, and the metabolism of the brain is changing, and there's things going on that we can't see very well that we're working on. But probably the answer is both things. It's shrinking, and it's also not firing in the right ways and as synchronized and working optimally like it was before.
Did you say the brain starts shrinking at age 35?
Yes.
That's not what
Yes,
anyone's going to want to hear.
Well, but this issue of normal aging versus, disease, there are changes that are happening in the brain as we get older, and we have to sort through that to understand if it's dementia or cognitive decline. But there's a little bit of shrinkage, yeah. But you don't run as fast as you did when you were, say, 25, and your brain peaks in the 20s and 30s in terms of size, and then there's a little bit of shrinkage as people age. And then when we have a disease, though, there's accelerated shrinkage. Something like Alzheimer's disease really doubles the rate of shrinkage that we see normally.
Kim Bosley Moore has a question for Dr. Mann. She wants to know if using earbuds regularly, what our kids are all wearing, increases the cumulative risk of hearing damage.
I think it depends. And a general rule is that if people around you can hear the sound coming out of your earbud, it's too loud. So when you're at the gym or somewhere loud, I think that's where it's really important to check it out and make sure it's at a safe level. But generally, they're safe.
On airplanes, you really have to crank up your hearing buds.
You do.
To hear over the noise of the plane, and you don't realize it till it lands. And you put your earbuds back in later on, how loud you had it that whole flight. I find that interesting. Joellen McGranahan has a question for Dr. Coffey. She writes, primary care, audiologist, geriatrician, where is the best place to start with these questions?
I think starting with your primary care doctor is always the best place to start, and they can help plug you in to wherever you need to go next for your hearing evaluations, or talking about, if you need to see a neurologist, or moving forward, who are the specialists that can help.
I've always wondered, what age should people get a geriatrician? Because I heard it said that you should get it before you're a senior. You should get one before you're a senior citizen? Is that what you recommend?
Well, we do say at age 65, if you're thinking about needing somebody to help not only with your primary care, but management of what we call the age-defining illnesses, then 65 is a great time. But for some folks, you don't need a geriatrician that early. You can wait till 75. Some people may have an early onset memory impairment that maybe they need to see one a little earlier. So there's not a hard and fast rule, but about age 65 is a good time.
Question just came in from Vera. I'll send this to Dr. Burns. She wants to know if undiagnosed sleep apnea could have any effect on dementia or Alzheimer's.
Yes. Yeah, very much so. We can see, cognitive changes with sleep apnea. So that can be, as I think Dr. Coffey mentioned this, that if we're seeing cognitive changes in somebody, we want to be thinking about things other than Alzheimer's disease and dementia. And so sleep apnea is one of those things. It has an impact on the brain in people without memory problems and can cause memory issues, and it has an impact on the brain in people who have Alzheimer's. So something we want to be sort of vigilant about and look for, and then treat if at all possible.
This is such an important topic. I'm so grateful for all of our doctors that are here today. For today's takeaways, I want to start with Dr. Mann. What's the one thing you want people watching to take away from this discussion?
I think my one message would be to get connected. Go see somebody if you think you need a hearing test. Get connected back to your world, and also know that it isn't just hearing aids. There's a lot of other things we can do, like brain fitness programs that are specific to hearing. Brain HQ has an auditory intensive program that you can do on your app at home. So we have resources to help get people sound, get them engaging, and working out their auditory brain. So don't be afraid of hearing aids. There's a lot of things we can do, but just get connected and see somebody if you're suspecting you need help.
Dr. Coffey, what's the best way people watching this program can support their loved ones?
I want to piggyback off of what Dr. Mann said, is to continue to stay connected with them, value them. Remember, the older adults really are the most stoic, wonderful individuals who have shaped and formed our country in amazing ways, and they not only should we honor and respect them, we should value them. And so stay connected, learn more about them, and that's what I would say.
I love that, and that's such a true thing. They have so much to teach us.
They do.
So much. Dr. Burns, what's the message that you want our viewers, to take away from this?
I think I'd say be proactive about your brain health. We think a lot about exercise and diet, but things like hearing aids, if your hearing is down, and as Dr. Mann and Dr. Coffey have said, it can cut you off from the world. And so think of treating your hearing as a way to enhance your cognitive stimulation and your brain stimulation, et cetera. So be proactive.
Dr. Burns, thank you. Dr. Mann, Dr. Coffey, we so appreciate you joining the conversation today. And thank you to our viewers for being with us as well today. We'll see you right back here tomorrow morning.
An autoimmune disease left one woman battling joint pain, fatigue, and even lung problems. I'm Jessica Lovell on the next Open Mics with Dr. Stites, how the health system is using a team approach from rheumatology to pulmonology to slow the damage. Wednesday at 8.